Day.
Thanks very much.
Thousands of women could be prevented from having to have hysterectomies by a new surgical technique which is currently undergoing trials. The procedure treats growths in the womb without the need for major surgery, and scientists say that early results have been encouraging.
The diagnosis is quite obvious of multiple large fibroids.
This ultrasound scan of the pelvis shows fibroids or growths in the patient's womb. When they become large, they can cause painful periods and bladder problems. As a result, around 20,000 women each year in the UK have a hysterectomy, which can trigger an early menopause. That was the option presented to Joanne Marshall when doctors found a fibroid the size of a half-term pregnancy in her womb. But luckily, she was put in touch with the hospital pioneering a new treatment for fibroids.
I stumbled across this process, but only because of my insistence. And the fact that the last thing I wanted, because of my age, being 34 and not having a family, I didn't want a hysterectomy.
Joanne was referred to the Royal Surrey County Hospital in Guildford. The new technique, which shrinks the fibroids, avoids the need for major surgery. It's performed under a local anaesthetic, using an X-ray image of the pelvis. A small tube is inserted into an artery in the groin and up into the artery which supplies the fibroid with blood. Small particles like sand are injected into the bloodstream, which blocks the vessels leading to the growth. Over the coming weeks, the fibroid shrinks.
It's a less invasive procedure, so the complications are less. The patient only has to spend 2 or 3 days in hospital as compared to weeks with a hysterectomy. And the convalescence period, we normally advise a week off work as compared to months following a hysterectomy.
The new technique, first used in Paris, is still undergoing trials, but early results from more than 40 patients here suggest it could save many women from an early menopause and infertility. Fergus Walsh, BBC News.